Hi, I'm Tom with Dennison Data, and I'm here to demonstrate the provider ranking system on the number 3 most common surgery done in America, joint replacement. Before we jump into the paid website, I'd like to show you at dennisondata.com, you can jump into our complimentary consumer portal and search for free. Here I already have an open page, 23470. That's what we'll be searching on the paid site. But if I went to procedure ranking, typed in HCPCS code, click facility. You can find here a listing of providers for that procedure using CMS data, the same CMS data we're about to use in the paid website. So I'll click on procedure ranking again. And we can search by HCPCS code or by description. I think we'll go ahead with HCPCS code, but I'll show you an example by searching by prescription. So arthroplasty is the keyword of what we're looking for. You can scroll through that and choose what you're looking for, shin, shoulder, hip, knee. Let's see. So it's showing a list of 12. We can expand that through Medicare. I use 12. So all these are dynamic columns. You could sort them alphabetically or numerically, or you could filter them as well. If you say, well, I only want to see providers, I only want to see the MDs. You can drop it down, limits it to MDs. Now, granted, PAs, I'm assuming, are working under an MD in this case. So, but let's go ahead and click on, let's say billed average. Who's charging the most? Who's charging the least? So the most expensive is the number 4 ranked provider. The lowest priced by far is number 6 ranked. So it's interesting, not much different in ranking, yet that's about an 1/8 of the price, I thought it looked like. So let's go ahead and click on this provider. Although they're in Hawaii, it might take you a flight out there, but nice place to recover. So their ranking, composite ranking score overall, they have a B. So it's 0 to 100 based. It's not 60 to 100 like back in school. This is based on a comparison to all their peers. So they are more experienced. They do this procedure more often, or there's not just this procedure, other procedures more often than 67% of their peers. In the US, they're ranked 16,606 out of 75,704. In Hawaii, they're number 6 out of 38, or in Honolulu, I should say. Their contact information here, NPI code here, billing and procedure summary, total Medicare approved amount, total amount billed, unique procedure codes, number of procedures, and a number of patients. Also, the Medicare approved amount has a percentage growth compared to the previous year, whether that's a positive number or a negative number. I mean, it could be a growth or decline. Number of amounts and patients, you could change this to. Right now, we're looking at amounts for dollars, or we can change it to patients, number of procedures done on number of patients. Provider background, it says other. Sometimes it says the name of the school they went to, the year they graduated, total list of specialties, their physician's assistant, hospitals they're associated with, their address, phone number, PACOS ID for home care, MIPS score ranging from 0 to 100. They have an 89.5. Patient demographics and risk profile, whether or not they accept Medicare, the gender of this provider, the RUCA number. So if you click on that, it says rural to urban commuting area. So they are 1. That means urban. It's an individual provider. Average age of patients, 75, 59% female, 43% white. and so on. Top 11 comorbid conditions seen by this provider. If there's up to 15 of comorbid conditions the provider treats, we will show you on the paid website on the providerrankings.com. We will tell you up to top five comorbid conditions treated by this provider. Average risk score of patients 1.1012. 1 would mean average, 1.5 and above means high risk. So for the same year we searched, 2019, well, we can change that. Top procedures performed by this provider. Green means top 25%, yellow means top 50%. They're ranked in. So lots of green and lots of yellows. I mean, they seem like a pretty qualified provider, at least in the entire United States. These are also dynamic columns. They could be ordered how you would like. And then you could click on any of these rankings to bring you to a national chart and see how they rank to their peers. Explanation of the columns was found beneath that chart before. How the composite ranking score is made, how they receive that grade, the location, F meaning facility, O meaning office, merit-based payment system with the MIP score, what that means. Hope to see you again in some more videos. Thanks for joining me. I'm Tom Denniston.